What that did for me was made me realize that mainstream medicine and their teachings were political. It wasn't just about health. It was about making money irrespective of what the best treatments for people were. Because up until then, I thought, for example, that mainstream medicine was doing the best they could to cure cancer. I mean, I really believe that. And then I had a friend that I met when I came down here, and he said, no, they're not. Cancer is all about making money. How many people heard of Ralph Moss? Right? He wrote a book that maybe one of his first books, I'm not sure, called The Cancer Industry. And in that book, he spells it out. He said, this is not about curing cancer, because there were lots of cures that came around and disappeared, even though they were very effective. They were shown to be effective. In fact, those are the ones that disappeared. And he showed that in his book. And so it made me question what I was taught in medical school and residency, because here you think you're being taught the best available treatments to help people, and then you find exceptions. Chelation therapy helps people, but they don't want you to know about that. A lot of other cancer treatments that they don't want you to know about. Now, one of the pioneers, I guess, in vibrational medicine was Royal Rife. You've heard of that name? Few people have. Very interesting. He was not a doctor. He was just, I think, an inventor, maybe a scientist, you call him. And he invented a light microscope. Now, a light microscope has to be distinguished from a electron microscope, and I'll tell you why in a minute. You have someone else want to do? Who wants to come up? You're going to go next? Yeah. All right, and then you'll be next, and after that, and then you'll be after that. You want to do that? We'll do as many as we can. Okay, we'll do as many as we can. So the electron microscope is a newer version of a microscope, but in order to see anything, it's in a vacuum, so it's dead. So whatever you're looking at in an electron microscope is dead. You can see the benefits of looking at things that are alive, and that's what the light microscope allows you to do. And Royal Rife invented a light microscope that was far better than any microscope available then, and even to this day, it could enlarge bacteria and viruses and fungus more than anything else. So he can actually see them in a living state. And he had the idea that, because he knew that every living organism has its own vibration. Every cell, every part of your body has its own specific vibration. And if you could find that vibration, you could influence the cell. Now, you've seen in the movies, the opera singer hits a certain pitch and the glass breaks, right? You've seen that. Whether or not that is really done in real life, I don't know. Because some people say yes, some people say no. But the theory is absolutely true. If you can, for example, that glass vibrates at a certain frequency, and if you augment that frequency, you can create that vibration to the point where it'll break. And that's what Royal Rife did, only when he was addressing bacteria and viruses, even cancer. So he could look at those cells under the microscope, and then he had a frequency generator. He would turn a knob to change the frequency and find which one affected what he was looking at, and then he could raise the pitch of that frequency to kill the microorganism with a cancer cell. And he was doing that. And he was being very successful in curing people. In fact, so successful at the time, I think it was the president of the AMA approached him and said, I want to be a partner with you. And he says, no, this is not for profit, this is to help people. And that was the end of Royal Rife. So that technology sort of disappeared. We do another treatment in the office called, and I have a brochure in the back on that, called ultraviolet blood treatment, or we call biophotonic therapy. Have you heard of that one?
Yeah, I've done that one.
You know all that, and you've done it. And that's an interesting one, because that, and I bring all these up because we're talking about electromagnetic medicine. We're using frequencies to help the individual. Now that one exposes your blood to ultraviolet rays. And that was done in hospitals back in the 1930s and 40s, very effectively. They would treat people with serious infections that were expected to die within a couple of days, but instead of dying, they got better and went home. Now, back in the 30s and 40s, this was before antibiotics, and they had a very effective treatment. Then when antibiotics came around, they said, well, we can make more money selling antibiotics, and the ultraviolet treatment, which really doesn't cost much relative to antibiotics. So that treatment disappeared. But we do that, very effective in treating patients for all types of problems. Chelation therapy, by the way, was also used by mainstream medicine, by the way, in the 1950s. It was written up in mainstream peer-reviewed journals saying how effective it was in curing chest pain related to poor circulation to the heart, until the heart-lung bypass machine made it possible to do bypass surgery. Then they said, $3,000 or $30,000? Which one should I do? Right. So that's when they started saying chelation therapy was not a good treatment. But it was a good treatment until they could make more money with another treatment. And they've done that throughout the years. Obviously, you know, the treatment that makes the most money is the treatment that's going to get promoted. It doesn't really matter whether or not one treatment is better than the other. Pick the one that makes the most money. Another treatment we do that more people need to know about is thermography. Everybody heard of thermography? Thermography is a way of visualizing your body, and all it's doing is looking at the heat that your body is emitting. Now, heat is another form of electromagnetic radiation, electromagnetic field. But what we do is look at the breast tissue in women. And if you see, a normal breast will be symmetrical in temperature and cool. So if you see hot spots in the breast, you know there's something wrong. It doesn't mean you have cancer, but it means you're at risk for something. And usually it's associated with hormonal imbalance. Sometimes we're picking up cancer. But the point with thermography is you can identify women as much as 10 years before a mammogram will show cancer. So it gives a woman time to correct the problem, maybe avoid the cancer. There's another treatment that mainstream medicine doesn't like.
Are you doing it in-house now?
We do those in-house, yeah. Now, here's why they don't like it. Mammograms don't identify women before they get cancer. They identify women after they get cancer. So a woman will do a mammogram every year, and after 10 or 15 years of doing mammograms, we found the cancer. Well, there are a couple of problems with that. Mammograms expose you to radiation. Now, that radiation increases your risk of mammograms. So theoretically, if you do enough mammograms, you're guaranteed to get breast cancer. So there's a self-fulfilling prophecy. They say about each mammogram increases your risk of breast cancer by about 1%. So if you start doing mammograms in your 40s, by the time you're 60 or 65, you've increased your risk by about 25%. That's not a good thing. So what I recommend to women is avoid mammograms. The radiation is no good, the compression is no good. But more importantly, the interpretation of the mammograms are very inaccurate, because when they send a woman for a biopsy, about 80 to 85% of those biopsies will come back negative, which means they thought they saw cancer and they didn't. So what we like to recommend is a thermography. If you identify women at risk, sometimes all you have to do is repeat that thermography with a few changes in your hormonal balance and supplements, and the problem goes away. If it's a more severe problem, we get an ultrasound or an MRI of the breast, because that will be the best way to visualize the breast without exposure to radiation or compression. And it makes a lot more sense. I'd just like to say, for those women in the audience, for whoever, when this may or may not apply to, if a doctor, if you've had mammograms, or you're still going to get mammograms, and they tell you we want to do a needle biopsy, I recommend against that as well, because needle biopsies increase the risk of spread of the tumor. So now what you do, and it's always a dilemma because you're scared. And if you think about it, every time you see a commercial on TV about some health problem, they're scaring you into their procedure or their treatment. The thing I'm scared about is all the side effects associated with those drugs, if you listen to them. So what to do? They said, first of all, about 1/3 of breast cancers disappear spontaneously. That's been reported. So they better hurry up and treat you before it goes away on its own. The other statistic that's kind of interesting is that 15% of women with breast cancer die from breast cancer. That means the other 85% live. And what does that mean? They're treating 100% of women with breast cancer to save 15% that are going to die. The other 85% would probably have lived anyway, lived without treatment. the real difficulty is how do you differentiate which group is which? Well, I think, and you probably everybody in this room knows someone that's had breast cancer, or maybe has died from breast cancer. Those people that have died from breast cancer are most likely treated. So the treatments for breast cancer are not that good. And if you look at the statistics of mortality associated with breast cancer, you find that the mortality hasn't changed. In other words, the same percentage of women are dying today from breast cancer as did 50 years ago, even with all the treatments. So what that tells me, and by the way, that statistic applies to men with prostate cancer. I haven't made a change, although we're making lots of money treating it. And the change that hasn't been made is we're not curing people. About 15% of men will die from prostate cancer, and the 85% of the men that have it won't. They'll live with it and die from something else. So, and here's the 2 points you have to remember. People usually don't die in a couple of years from breast cancer or prostate cancer. And when you hear of a woman dying in a couple of years, they're probably dying from the treatment and not the disease itself. But this is why my emphasis is on prevention so much, with chelation therapy and removing the toxic minerals from your body, thermography and identifying women at risk so we can intervene early and try and prevent that occurrence. And you know what? Where am I? Here they are. Okay. You know, identify people at risk so they can change what they're doing and reduce their risk of getting a disease. The testing is important. Vitamin D levels, I think, are important. Not the only thing that's important, but we can at least measure it. You know, we find about 100% of people who aren't taking vitamin D supplements are low. The range is 20 to 100. Most people come in around 20 or lower. We'd like to get them up to about 80 or above. And so now we get, so here's what's happened. So now we know that mainstream medicine has lied to us. You know, they tell us this is the only treatments that work, nothing else is relevant. And of course, that's not true. We know chelation is helpful. Ultraviolet treatment that was used in hospitals is still relevant today, although, you know, it's not something that they don't promote anymore. Thermography, they just promote mammograms and not thermography. Thermography is very important. The one thing they all have in common is trying to either identify people at risk at an early stage and try and prevent illness. You see, mainstream medicine doesn't do that. They want to find the people once they're sick so they can make money on them. That's a distinguishing characteristic. I'll give you another example of that. If you go for a stress test, everybody's familiar with that. Now, here's the question. If you pass the stress test, does that mean you don't have heart disease?